If you've been following some of my other videos, you've probably seen by now that I tore my Achilles.
Oh no.
Yeah, not super fun. But I am lucky enough that not only am I a physical therapist, a board certified orthopedic clinical specialist, but I ended up kind of specializing in Achilles rehab. This is one of my favorite surgeries to rehab, and now I got the inside scoop. See, when I was in residency getting my orthopedic clinical specialist, I got transferred some patients that their Achilles rehab wasn't going too well. So they started seeing me, and my mentor made me do tons of case presentations, research, and ultimately I spent a ton of time studying and working on Achilles tendon repair. I spent hours and days studying about this topic and procedure and how to get the optimal outcomes. And fortunately now I've gotten to rehab some of the top pro athletes for their Achilles tendon repair. So today I want to share with you not only are my insights from physical therapy, but my own experience rehabbing my own. We are going to get into your boot protocol, touch on some of the basics of the exercises early and later on, what you can't do early on, what you can do, what should you expect, and lots of tips on how to make the journey comfortable and better starting day one, including a list of many helpful items to buy. So let's go ahead and dive in. First off, you're watching this because you've torn your Achilles. I'm so sorry. I am with you. I've been there. And there are a lot of ways we can make this process better. And almost every client I've talked to at the end of this says, although this was a really difficult process and they may not necessarily wish this upon anyone, there's so much good that comes from this process that a lot of times, including myself, wouldn't want to go back in time and change it. Injury is often an opportunity for a lot of personal growth that comes from going outside your comfort zone. It forces you to learn new things, adapt your strategy, work on some weaknesses you've been neglecting. But if you have gone through an Achilles tear or going through an Achilles tear and you've noticed some wonderful byproduct of this journey, please comment below. I'd love to read it. It's always amazing to see what blessings and surprises the universe, life, God, whatever you believe in brings upon us in these times of tests. So let's go ahead and talk about the injury and tearing it. And if this part makes you uncomfortable, please go ahead and skip it to the next section because I'm going to show a video of mine.
You good? Yeah. Did I kick something?
People almost always tear their Achilles by pushing off a stretched foot. So what does that mean? I have this lovely model here. Your Achilles tendon is in the back. It's where your calf ends and then it inserts on the calcaneus right there. And what happens is when you're planted on the ground, you're lunging forward to take off and sprint, your tibia is going forward and it's now stretching that Achilles tendon. And oftentimes when you're doing this and you push off at the same time, it's too much force for the tendon to handle and causes it to rupture. In my case, I was doing an acrobatic maneuver called the Webster. I've done this thousands of times, but even in grad school, I was thinking this is scary because I'm pushing off a stretched Achilles tendon. It is very high risk and sure enough, it happened. But in many cases, pickleball, basketball, soccer, tennis, people are doing these cutting maneuvers in which they're planted with their foot on the ground, their shin is moving forward, they're stretching their Achilles tendon, and they're also trying to explode and push off. And almost everyone reports the same feeling, that it feels like someone kicked you in the back of the leg. I knew this, and you can see right after I tore mine, I asked my friend, did I kick something? Because I was desperately hoping he would actually say yes, which meant that maybe I just didn't tear my Achilles.
Did I kick something?
I knew I tore mine in the air because I felt that feeling, I felt it stretch, so I chose not to try to land on my foot, but it happened and here we are. Once it happens, there's a few tests that you can do actually to diagnose it. Oftentimes these tests are really good and may not even require an MRI. The number one classic test is called the Thompson squeeze test, in which you squeeze the calf, and an intact Achilles, the foot should point as a result of you putting tension under the calf muscle. But in the case of a torn one, when you squeeze the calf, you'll just see that foot doesn't move. This test is actually really good at ruling in and ruling out an Achilles tendon tear. Some studies have the sensitivity at 96% and specificity at 93%. That means there's a 96% chance that if you're negative on this test, you don't have a tear, and a 93% chance that if you're positive on this test, you do truly have a tear. So although they're not 100%, they're very good. The other thing that we'll often see if somebody has torn their Achilles is that when they're resting on the table and you're looking at their feet, the torn side will be resting in more dorsiflexion. What does that mean? Dorsiflexion is when your foot is making the letter L shape. And you can think of plantar flexion as when you're trying to point your foot, almost like a ballerina. So your calf is responsible for doing plantar flexion. And if the bridge between your calf and your heel is torn, oftentimes your foot won't have tension and it'll be hanging out and more dorsiflexion. So one of the ways we know besides the squeeze test is if someone has torn their Achilles is we'll look at their foot and we'll see that their resting tension lies in more dorsiflexion. Now in my case, as soon as I tore it, I asked my friend if I kicked someone, didn't. And then I tried to see if I could still point my foot. And for the first few minutes, I still could, but little by little, my capacity diminished. See, the thing is, your calf is the main muscle when it comes to pointing your foot, but you have other muscles in the lower leg that can do so, such as your post-tib, your fibulari muscles, and even some of your toe flexors can also help. I thought I maybe got lucky and it was just a partial tear, but partial tears are incredibly rare in these acute traumatic cases. And even if it's a partial tear but substantially torn, operation may still be the best treatment, which we'll get into. One of the first things you want to do if you just did tear your Achilles is don't put any weight on it. Put your foot in a boot, and more specifically, when you put yourself in the boot, you don't want to be in dorsiflexion. You do not want your foot to make that letter L shape. So how are you going to do that? Well, what you can do is when your foot is in the boot, instead of having flat on the ground, if you can put some heel wedges under so that your foot is more pointed, that will prevent it from being in that letter L shape. And what that does is it allows the two tendon ends to potentially join together. This helps us in two cases. One, if we want to do non-operative, it's really imperative we do that ASAP. And then two, even in an operative case, if we can prevent that tendon from stretching and gapping, in theory, it may help with some of the surgical prognosis. You want to get one of these high cam boots, controlled articulating motion boot. I got mine off Amazon. You want to get them to where they go up to the knee and put lots of heel wedges in it. If you can't get heel wedges soon enough, what you can do is just roll up some towels and put it under your heel. Secondly, you're going to want to get on crutches or scooter ASAP. Crutches can be pretty uncomfortable on the shoulder, but you can buy these fake sheepskin things that add a little bit of padding. I thought they were wonderful, and I have the Amazon link below. And you can get an MRI or even an ultrasound to diagnose it because it's kind of right under the skin, so oftentimes ultrasound is good enough. But in some cases, the orthopedic surgeon won't even need that because they can do all those other tests that we mentioned before and come up with the diagnosis. So then the question is, should you get surgery or should you try to rehab it? There is no definitive answer. It's a personal choice and everyone's context matters. What does your life currently look like? What do you want to be able to get back to doing? If you're a young professional athlete or an elite athlete, surgery does seem to be the better option because you might be able to get more calf strength resulting in plantar flexion torque, which matters in that competitive athletic sense. But if you're a recreational athlete or sedentary, you might be fine without the surgery. Also, if you want to do the non-operative route, it's very important that you do get your foot in a pointed position very early on. Oftentimes you go to the emergency room or urgent care and they cast you in a dorsiflex position, and that might make the non-operative outcomes worse. We really want to make sure we get within that toe point in the first few days. And the other thing, there's a downside to surgery, which is the risk of infection, nerve palsy, or DVT. Really, infection is the main one we're really worried about. It's very deleterious, meaning it can cause a lot of issues, so we definitely want to avoid that. So if you're someone who's diabetic or a smoker, your doctor may take that into consideration and may worry about the wound healing with the surgery, and that might also be a conversation for why you should be a non-operative candidate. One of the downsides of non-operative is there's a slightly increased chance of re-tearing it, and secondly, you may not get the same strength that you would have gotten if you chose operative. We mentioned the risk of infection, which we're going to get into. There is a small chance of a nerve injury. The sural nerve is a sensory-only injury, meaning you will not lose any motor function, but you may have some temporary numbness and maybe even permanent. It's very rare, and obviously a better surgeon will help reduce the risks of this. And the last one, DVT, deep vein thrombosis, is a blood clot. It's very rare that this happens. There's some strategies for minimizing it with aspirin and medications, but it is another risk to consider. I was lucky enough to get surgery with Dr. Timothy Charlton at Cedars-Sinai within 48 hours of the injury, which is wonderful. In general, the sooner we can get that procedure, the better. However, we really try to get it within the first 2 weeks. Regardless of the surgery or not, you're going to want to chill for a few days, whether you're casted or in the surgery. If you did get the surgery, you'll probably experience the most pain the next day. The day of the surgery, you might have a nerve block and not feel any pain. In my case, I went out to a friend's house for like a TV premiere party the day of the surgery, but the next day I woke up in quite a bit of pain and had to do some of the pain management. But that only took me 24 hours, and after 24 hours, I was not taking any medications for pain. Just be patient in the beginning. It's always the hardest part. Each day gets better. You have more that you can do. There's less pain, less limitations. So if you can get through the first few days, you can definitely get through the whole year. Right after surgery, we want to reduce the risk of infection. And if we're in a cast, we cannot get that thing wet. That could definitely increase our risk of infection. So when you shower, I recommend two things. One, a shower chair, because obviously you're not going to be able to put weight on it. And two, a shower cast. They sell them on Amazon. They're wonderful. It's a sleeve that goes over, kind of closes above your leg, very easy to come on and off. And what it does is prevent a lot of water from getting in there and then causing that cast to get wet. If that's the case, you might have to go see your orthopedic surgeon immediately to get it removed and recasted. That's very annoying, but we cannot risk getting an infection on the surgical site. Get the shower cast. I'll put the Amazon link below. Another thing is if your shower does have a handle to rinse yourself, it's a little bit easier, and also a handle for getting in and out might be necessary too. Once you're out of the cast and into the boot, it might be a week or two. Sometimes a surgeon will then clear you to let it get wet, and that's huge. Some surgeons will put you in a cam boot with some heel wedges. There's also the Vacoped, which is a boot that's dynamic. Basically has the heel wedges built in and allows you to adjust it and eventually walk with a little bit dynamic. They both work. The Vacoped's a little bit more expensive and fancy, but if you can't afford it and you just want to do a cam boot, that should be fine too. There are also a few other devices that really help with getting around. There's the iWalk, which is almost like a little peg leg, so you can put your knee in it and walk. I didn't find it super helpful because it was really tough going up and down steps, but some people love it once you get past the learning curve, and it allows you to be able to work and do certain things on your feet. Instead, I ended up using a knee scooter for anything that I needed to do. That way I was able to keep up with my friends and do day-to-day tasks. Another thing is when you do start walking on the boot, that boot will be higher than your other leg. So what some people do to help even it out is they get one of these even ups. That way you can attach it to the bottom of your shoe and essentially raise your shoe so that it matches more the boot. What it does is just prevent you from having this hip drop, which sometimes can cause some hip and low back pain. It's not a deal breaker if you don't want to get it. You'll be perfectly fine without, but some people find it much more comfortable with it. Again, the Amazon link will be below. And another thing is heel wedge inserts. There's these little heel wedges that you can slide in your shoes so that when you get discharged from the boot, you can start transitioning the shoes, but it's not a huge drastic shock. Now, for those of you that paid attention, you might have noticed that I tore my right foot, which is really not fun when it comes to driving, but they do sell something that is basically a conversion kit so that you can use the accelerated pedal with your left foot. There are different state laws on how you do this and what's appropriate if you have to get it registered and tested with the DMV, so please consult with your physician and make sure you're adhering to state laws. But what it does allow you to do is to get back to driving once you're not on any pain meds. I found it helpful. It does take some time to set up, but it was allowing me to be able to have a normal life. So if it's something that you feel comfortable with, your physician feels comfortable with, and obviously abide with the state law, it is definitely something helpful, and the Amazon link will be below. Handicap parking. If you do end up getting a handicap parking placard, here's a few tips. One, if you're a AAA member, you can usually get it at AAA. It's a little bit faster than the DMV. Number two, besides being able to park in handicap spots, currently in California, there's some additional benefits. You don't have to pay the meters, and you can stay longer than the time limit. That doesn't mean you can park illegally in red areas or just everywhere, but a lot of these temporary parking places like green curbs allow you to stay there for as long as you want. Obviously check the laws. They may have changed and it may vary state by state by the time you're seeing this video. Okay, now let's talk about some of the important concepts of the rehab early on. Basically, the number one thing we do not want to do for the first 3 months, and sometimes even a little longer, is stretch that Achilles tendon. So that looks like doing dorsiflexion. The reason is this tendon is going to naturally loosen up for even up to a year, but it's really going to loosen up quickly in the first 3 months. So we got to be very careful because a lot of mistakes previously, what happens is people feel stiff after surgery. It's very normal. Your surgeon tightened up your Achilles tendon pretty tight, and no matter what, it's going to loosen up. So we found this one. Sometimes are people too aggressive about trying to stretch it and do so many fancy exercises early on. They then make that tendon permanently loose, and then we may not be able to get that stiffness ever again. I tell my patients, if you're too tight, it's almost like having too much money. We can always spend it later, get a little bit more mobility down the road, but once we're in debt, it's really hard to get out of it. So do not stretch your Achilles tendon. Make sure you do your exercises supervised by your physical therapist. Really in the first phase, we're just gonna work on some calf activation, very gentle things, using some heel wedges to block ourselves from being able to do too much and get a stretch in it. But we cannot stretch it. It's very imperative. We will get that mobility later. It can come back pretty quickly. The hardest part is really going to be about getting our calf strength and really getting that calf strength at that end range position. That's where people are almost always weak. So I usually obsess with my clients over this detail very early on, and then we later get that mobility. Another thing that you can do is pool therapy. Pool therapy allows you to start doing some of these standing heel raises, but with the water up to neck deep, it allows you to do some more advanced exercises early on. I have another video about how to progress pool therapy. If you're curious, please make sure your incision is healed, you're cleared by your physician, and you are doing this with your physical therapist to make sure you're not overloading your tendon too much. I got these rubber heel wedges that go for the outside to make it a little bit easier for your exercises. That way it doesn't allow you to stretch. So I use them in the pool and I use them on dry land. I'll definitely send the Amazon link, put it below. so that you guys can order those as well. Besides that, I tell people early on, you're always welcome to work on your core, your upper body, all kinds of things that don't put too much stress on your Achilles tendon. So day one, I was doing bench press and dips and pull-ups and core exercises. That's totally fine as well. You're gonna be going through various stages of walking. I have another video that walks you through the various stages of Crutch progression, but you do need to make sure that your weight bearing is appropriate, not overdoing it and causing a little bit of tendonitis in the Achilles, because that can actually reduce some of the tension and increase tendon lengthening, which we do not want. And you wanna make sure you're adhering properly to that post-surgical protocol, because you might supposed to be walking in the boot. That doesn't mean you can walk barefoot, because you might start stretching the Achilles tendon too quickly. We need to avoid that. In my case, when I got out of the boot, I put those heel wedges in to have a nice transition. I got these high tops from Strike Movement. I'm not sponsored by them, although I love their shoes. They have a wide toe box, and I got a high top specifically so I could sneak a few extra heel wedges in without my heel slipping out. As you progress through your rehab, that's where you might need to do some more mobility work, which could look like soft tissue of the Achilles, and it can also look like some joint mobilizations, because what happens when that Achilles tendon gets thick, sometimes it's hard for this bone to glide backwards. And that is important, because as you do get your dorsiflexion, if this bone has a hard time gliding backwards, you get this pinching feeling and it feels like you're stuck. So it's really helpful to have a physical therapist to work on loosening that up when it is appropriate, and also working on some of the scar tissue mobility. It is a long road to recovery, and some research shows that you may not even get 100% capacity after a year or 2 years. You're gonna have to be patient. That doesn't mean it's gonna take 2 years before you go back to your sport, or it's gonna take you a year to participate in anything. We just might have to make some restriction modifications for a decent amount of time. And if you're unsure about whether you're ready to return to sport, this is where it's a good time to talk to your surgeon, do some return to sport testing like I do to make sure that your function is good, you're hitting all your metrics. I'm a huge fan of collecting lots of data, so there's no guesswork. So I use a handheld dynamometer. I have a battery of tests that we do to check if people are ready to return to sport. But every sport has different demand, but you may be able to jump into different ones sooner or later. The journey is a long one. It's not uncommon to have some deficits that persist afterwards. In some studies, only 82% of people really return to their sport after a year of Achilles tendon repair. But one of the issues is there's so much variety in how people rehab, and we've gotten better and better. And if you're with someone who knows what they're doing, you probably will have a better chance of success. If you want to rehab this 100%, really get a good physical therapist. Make sure you have the right team behind you, and also make sure you're working on your personal growth in the meantime. Life is really short, and even though this is a long recovery, don't waste a year of your life just being sad and bitter the whole time. We're gonna make some restrictions to our sport, but we're gonna focus on developing other things. You can study footage, work on other parts of your life, get stronger in other parts of your body, and really make the most of this year. Before we wrap up, I'm gonna put that list of things below that you can buy on Amazon, and I have links in the description to help. If you have any questions, please don't hesitate to reach out. I am based in Los Angeles, California. I have 2 offices currently, one in Agora Hills and one in Venice, California, and I can also come to see you. You can find my website at unityphysicaltherapy.com or social media at unityptla. I hope this video was helpful. I'm sorry if you're going through an Achilles tendon tear, but I'm here for you if you need anything. Please find someone who's an orthopedic clinical specialist. If better, you can find someone who's kind of a nerd and an expert in Achilles like myself. I'm super happy to help. But obviously, if you can't see me because you don't live in the Los Angeles area, please look for an orthopedic clinical specialist when you're looking for a physical therapist. Good luck on your journey, and I hope this video helped you.